So again, my name is Bryn. I am a licensed professional clinical counselor supervisor, and I am also the consultant and trainer for cognitive remediation here at the Best Center. And today I'm going to talk to you a little bit about cognitive health and how it might apply to your work and your lives. In order to understand why cognitive health is important, we need to understand the basics of cognition. Put simply, cognition is our thinking skills. We use cognition to process information and make sense of our world. Cognition includes many abilities that work together for our optimal functioning, including but not limited to the ability to learn new things, pay attention, use intuition, judgment and decision-making, language and communication, memory, planning, organizing, and goal setting. Let's look at a scenario to see the ways we use our cognitive abilities in an everyday occurrence. If you are scheduling a doctor's appointment, you need to pay attention to the administrative assistant, understand what has been said or written, think about other appointments and obligations you have planned so you avoid scheduling conflicts, remember to write down the appointment, and then remember to look at the calendar on the designated day. You also have to be able to plan how you will get to the appointment and then organize yourself to make sure you're there on time. You may even want to make notes about the things that you will need to discuss at the appointment. So it's easy to see that in order to do a simple everyday thing, schedule and attend a doctor appointment, you need many cognitive skills like attention, language comprehension, memory, organization, and planning all functioning well together. It would be difficult to get to the appointment if these skills were not working well. You might be emotionally ready and willing to have the appointment, but if you don't remember it, or if you double book something, then you might miss it. Cognitive health is related to brain health and how well our cognitive or thinking abilities are working. A healthy brain is one that can perform all the mental processes that are collectively known as cognition. A healthy brain can handle both simple and complicated scenarios. So good cognitive health is often referred to as staying sharp or thinking clearly. If you're working with or know someone in good cognitive health, you might notice them being able to focus for extended periods of time, being able to recall someone's name, keeping a schedule up to date in their mind. You might notice them being able to cook a new meal with minimal difficulty, thinking and speaking coherently, and using common sense or being able to handle a given situation appropriately. So in contrast, poor cognitive health might look like difficulty focusing, not being able to remember names, missing appointments, not initiating new activities, or having difficulty doing so. For example, trouble with trying new things or starting conversations. Thinking and speaking might be disorganized, and using poor judgment can also be a sign of cognitive issues. Cognitive impairment, like many things, can be viewed on a spectrum ranging from mild to severe with the potential to swing either way depending on circumstances. So cognitive impairment, where does it come from? Well, we know that pre-existing or coexisting conditions can cause cognitive impairment. While age is the primary risk factor for cognitive impairment, there are many other issues to consider, such as family history, an education level. Has there been an injury to the brain? Even some medical conditions like heart disease or stroke can cause cognitive problems. We also know that mental illnesses such as schizophrenia are likely to lead to cognitive impairments. Unfortunately, sometimes poor cognitive health can impact lives on a devastating scale. An individual with poor cognitive health not only has personal struggles, but broader consequences can often be seen in the following. The community can be impacted with individuals not being able to live independently. This can add stress to family and natural supports as well as community services. Mental illness can cause cognitive impairments and often begins for individuals in school, high school or college, those formative years where problems with attention, memory, problem solving, and social skills can literally stop someone in their tracks by inhibiting their development. Research tells us that many individuals suffer a disruption to their college education after a first episode of psychosis. Fortunately, those who experience symptomatic recovery after psychosis have a significant likelihood of returning to college. Sadly, though, these individuals often struggle with issues of self-confidence as they navigate their post-first episode lives. Not believing in yourself can have a great impact on your life. One study showed that depression was associated with low self-esteem and that low self-esteem was a risk factor for overall decreased quality of life. Individuals with persistent mental illness often suffer cognitive impairments that disrupt critical thinking and problem solving. Most jobs include having to remember new information, recall old information, and deal with changing demands. This is difficult when cognition is not working well. I'm sure many of us can relate to having a stressful day at work, right? Juggling many things and feeling overwhelmed. Imagine trying to handle a day like that with memory, problem solving, and/or focus issues. So it's easy to see how cognitive problems can affect one's ability to maintain and succeed in a job or a career. Research has demonstrated that people who have difficulty with memory, problem solving, processing speed, and attention are more likely to be unemployed. And imagine how relationships might suffer when a person with cognitive impairments is not able to attend to or remember what a friend said. The ability to pay attention, be focused, and not get distracted is vital for social functioning. The consequences of poor cognitive health are vast and can have a domino effect to negatively impact an individual's quality of life and their community. However, individuals struggling with poor cognitive health can improve and make strides toward recovery by engaging in programs meant to target their problem areas. With many causes and risk factors to cognitive impairment, you might be wondering, how do I maintain a well-functioning brain? How do I keep my memory sharp? Or how can I improve my memory? Or maybe it's something like my son or daughter is having trouble focusing. What can I do to help them? Well, doing a Google search for how to keep my brain healthy produced over 200 million results. So how do you know what to do? Research supports these practices as preventative measures for maintaining good cognitive health. Exercise has been shown to relieve symptoms such as insomnia, anxiety, and depression. In addition, studies suggest exercise may not only ward off cognitive decline and dementia, but improve cognition in people who already struggle with memory problems. One study showed that supported and supervised physical exercise is not only a feasible and safe addition to the standard treatments for first episode psychosis, but it has potential cognitive benefits as well. A healthy diet has long been recognized as promoting better cardiovascular health and lowering the risk of certain cancers, but now promising research says that it may also protect against cognitive decline. This is an example of where good coordinated specialty care for first episode psychosis can assist. Case management, for example, could help an individual with creating a shopping list and navigating a grocery store. Our bodies rely on regular sleep for a variety of essential functions, many of them in the brain. Studies have shown that people who regularly sleep less than the recommended 7 to 8 hours a night score lower on tests of mental function. This may be because learning and memories are consolidated during sleep. Therefore, getting consistent, good quality sleep is known to improve overall health and may prevent cognitive decline. Sleep hygiene could be addressed by members of a first episode team as well by providing education, assessing for problems, making referrals, and so on. Maintaining a healthy brain often equates with the habit of staying mentally stimulated as you age. Reading, learning new things, getting better at old hobbies, keeping a schedule, and generally engaging your thinking skills are great for your brain. And lastly, people with strong social ties are less likely to experience cognitive decline than those who are alone. By contrast, depression, which often goes hand in hand with loneliness, correlates to faster cognitive decline. Having a strong network of people who support and care for you can help lower your stress levels. And social activities require you to engage several important mental processes, including attention and memory, which can also strengthen cognition. Research also supports cognitive remediation as a training approach designed to reduce cognitive deficits and improve cognitive abilities. Evidence has shown cognitive remediation can improve memory, attention, executive functioning, and other neurocognitive abilities, sometimes including social cognition. If seeking a cognitive remediation program, experts agree on certain features in order to glean the benefits of improved cognition. Those features include therapists who are collaborative and encouraging, who understand cognition, cognitive deficits, and how they manifest in daily functioning. And though computer programs have become increasingly popular for brain training, they are not enough to produce the robust benefits of evidence-based cognitive remediation programs. Another critical feature is cognitive exercise. Experts agree that it is important for participants to engage in intensive training with multiple repetitions in order to produce meaningful effects. Increasing the difficulty level of the cognitive exercises allows the tasks to remain challenging and engaging. Immediate feedback should be given by a strength-based therapist who focuses on the participant's ability to stay engaged rather than on their performance. Development of problem-solving strategies. Due to impaired cognition from the illness, individuals with schizophrenia are often not aware of specific problem-solving strategies that they are using in everyday life. A goal of cognitive remediation is to allow the opportunity for identifying and testing new strategies and evaluating and comparing their worth. Thinking about one's own thinking, or metacognition, is often new to those in cognitive remediation programs, but with practice and self-evaluation in a setting that supports, encourages, and praises self-generated ideas, participants become more self-confident and can begin to transfer gains to their personal lives. The last component that experts agree is pivotal to successful cognitive remediation programs is focusing on transferring skills to real-world functioning. Clinicians work with individuals collaboratively to set goals, which have clear links to community functioning and have multiple short-term objectives that are achievable and measurable during treatment. For example, does the participant want to find a job, and what steps will they need to take, and what objectives need to be met before that can happen? Using group techniques such as discussion, role play, that gives participants an opportunity to practice for the real world. Coping with cognitive impairments in individuals with psychosis can be difficult. However, as I mentioned earlier, cognitive remediation is a training approach designed to reduce cognitive deficits and improve cognitive abilities. One cognitive remediation expert said, by focusing on cognitive health in addition to mental health, cognitive remediation seeks to improve critical thinking skills, enabling people to be more effective in their daily lives and pursue their goals for recovery in a purposeful and meaningful way. Two cognitive remediation programs which the Best Center supports are Cognitive Enhancement Therapy, CET, and Action-Based Cognitive Remediation, ABCR. CET is a cognitive remediation program where participants work at recovery through structured group and computer exercises, and ABCR uses goal setting, behavioral activation, and role plays to show how new cognitive strategies are used in real life tasks. Sorry. When seeking care for cognition, keep in mind the following. Good care, including shared decision-making as in all FIRST services, careful choice and dosing of medications that will help to avoid adverse side effects, hence lending itself to better adherence, a well-rounded treatment team that addresses not only the illness or injury, but the deficits themselves. We know that a positive attitude about learning helps people make the best use of their cognitive skills. And a supportive and stimulating social and physical environment encourages people to cope better with their cognitive problems overall. Those with severe mental illness tend to underestimate themselves and their abilities, leading them to avoid cognitively challenging activities during treatment and in daily life. Keep in mind that providers are needed to play a key role in refocusing the individual on their goals of approaching cognitive challenges, making it a safe place to do so, giving praise and reinforcing everything from showing up to completing a program. And to maintain a healthy cognition status, remember to reduce risks to cognitive health. Consider the things that individuals can control to improve brain health. Take care of physical health, like managing blood pressure, eating well, being physically active. Keep your mind active. Hobbies, volunteering, learning new skills. It's not only good for your brain, but boosts self-esteem. Staying connected with social activities. Studies show how people who engage in personally meaningful and productive activities with others tend to live longer, boost their mood, and have a sense of purpose. These activities help maintain well-being and help maintain cognitive function. Many stress relieving activities have multiple benefits, such as exercise being used to manage stress, engage socially, try new things, as well as take care of physical health. So to review, good cognitive health is key to good quality of life. The gold standard of care for improving cognitive health for individuals, say on the schizophrenia spectrum, is both early intervention by coordinated specialty care for first episode psychosis and, if appropriate, cognitive remediation.